Although the Public Services United Nurses Union, headed by Venerable Muruthetwe Anandathera, announced yesterday that they would withdraw from the strike action, nurses did not report to work at many hospitals across the island today.
The nurses' strike, prompted by problems surrounding the granting of labour room training to nurses, continued for a third day today in all hospitals across the island, except in 4. The Public Service United Nurses Union decided to withdraw from the strike action yesterday, following the decision to appoint a committee headed by Treasury Secretary Dr. P.B. Jasundara to address the persisting issue. The president of the union, Venerable Muruthetwe Anandathera, said that a small section of the union's membership had not reported to work owing to influences by certain individuals. Patients were severely inconvenienced at hospitals across the island today as well as a result of this strike action. Services at most hospitals were carried out by the doctors together with minor staff.
The accident ward is a very busy place. Usually we require the assistance of nurses to get the work done. At a time when they are engaged in a trade union action, we cannot disregard the patients. Therefore, we are doing the best we can.
A patient who was admitted to the National Hospital following a road accident had this to say.
I have not been treated yet. I was supposed to receive treatment today, but I have not been treated. I have not eaten or drunk anything since midnight because they said they would be taking me inside.
Dialysis units at the Kurunagala Teaching Hospital were not in operation on Saturday as there were no trained officials. All in-house patients at the dialysis unit were transferred to the Anuradhapura and Kandy hospitals. The renal disease unit of the Kurunagala Teaching Hospital has decided to train doctors to use the dialysis units to address the hardships faced by the patients. Our reporter says that although the renal disease unit was functioning, other units at the hospital were affected by the strike action. Deputy Director General of Health Services Anand Gunasekera visited the Kurunagala Teaching Hospital today on a fact-finding mission.
It is happy to note that the director of the hospital, the deputy director and the doctors together with the specialist and the other staff are successfully carrying out the duties at the hospital. The theatres are functioning, the labour rooms are also in operation, the emergency units are also operational while all wards remain open. 4 units of the renal disease unit are also operating in the hospital.
Nurses from the Public Service United Nurses Union did report to work at the Anuradhapura Teaching Hospital today. The nurses' strike also rendered dysfunctional services at the Colombo South Teaching Hospital.
Do not engage in acts to deceive the people. I am not afraid to say this. The people are the ones affected by this. I am 75 years old. I am unable to seek private medication for my illness.
Doctors and minor staff together carried out the services in the hospital in the absence of the nurses. Although 270 nurses were slated to report for duty at the Matara General Hospital today, only 3 nurses turned up.
We treated patients at the OPD and in-house patients today as well. In the future as well, no matter the obstacles, we will do our utmost to ensure the welfare of the patients.
The same situation prevailed at the Kandy General Hospital. However, doctors succeeded in carrying out the daily functions of the hospital. Our reporter says that health staff assistants too assisted in these measures. Our reporter says that while nurses did not report to work at the Karapitia Teaching Hospital, patients were severely inconvenienced as a result.